I am Jim McCauley from the Riverside Trauma Center and also from the Needham Suicide Prevention Coalition, and we thought we would take a few minutes to talk with Lieutenant Baker from the Needham Police Department and Sue Keys, Director of the Emergency Services Team for Riverside Community Care, to talk about some of the ways that their services might be helpful to individuals or families who may be having a personal or a family crisis. So maybe I'll start with Lieutenant Baker. If you would maybe just kind of talk about some of the calls that you get from families looking for help or assistance.
We get a wide variety of calls from families. We get calls for domestic situations, whether it may be some assaultive behavior, threats, could be just an argument. We also get calls for stubborn children, runaways, people who just feel like they can't control their juvenile. We get calls for people who are depressed. We also get calls for people who are potentially suicidal. We get calls for people with substance abuse issues that may or may not play a component in some type of mental health disorder that they have. It's really pretty wide ranging.
Pretty wide range, yeah. It sounds like a,
Yeah.
And Sue, maybe could you talk a little bit about Riverside Community Care and the Emergency Services Team?
Sure. So Riverside in general, as you know, is a huge agency. We have a lot of different programs, and one of the kind of referral sources for a lot of our programs is our emergency service program. I'm the program director for the Norwood team. We also have a team out in Upton. So across the two different teams, we actually cover like 40 towns in the state. For the Norwood team, we cover 17 towns, which starts up in the Wellesley and Weston area and goes right down through the 128 belt into the southern border near Rhode Island. So we're covering Needham, Newton, Wellesley, Weston, Norwood, Walpole, Dedham, and the list goes on. And we are seeing folks all ages, all insurance, including those folks that don't have insurance at all. And so what we'll see is, like you said, either adults or elders or youth who are thinking about harming themselves or thinking about suicide. We see kids that are making violent threats towards their teachers or other staff or their family at home. We are seeing people with psychosis. Sometimes it's a first psychotic break, sometimes it's ongoing troubles with their psychosis. We see those with substance abuse and mental health together and try to help with referrals there as well. It's basically a self-defined crisis. I mean, if someone feels that they're not doing well and that they need to speak with someone very soon, then that's really an appropriate call for us.
And this is a service that any resident or family in Needham can use?
Absolutely.
Yeah.
Our referral sources really are anyone. The schools call us a lot, the police call us, the families call us themselves. Once in a while, the teenager calls us themselves. We'll have loved ones say, you know, someone doesn't seem to be doing that well and I'd like them to be able to talk to someone, and then we have a way to maybe get on the phone with that person and convince them if they meet with us, they may be able to get some resources in order to feel better. We are a mobile team, so often our referral sources will call and ask if we can come out to the home or if we can come out to the school, or a private practitioner might call and say, can you come to my therapy office and meet with one of my clients with me that's not doing well? And so we really travel. We also use our offices in Needham and our offices in Newton in order to see people who'd rather be seen in an office setting. And then we have our main office, our walk-in clinic in Norwood. So there's a lot of different opportunities to see people in different places for a variety of issues across the ages, across the insurance types.
Does it have to be an emergency for people to call you?
Not necessarily. We do a lot of things on an urgent basis as well. So a family member, like a parent, might call us, or a foster care parent, and say that the youth isn't doing well that night, but it's so late in the day that they may just have them go to sleep, and could they come in tomorrow? And so sometimes we'll make an appointment that next morning, or maybe after school the next day, or sometimes if they really want us to see them in the school setting, maybe where they are having the most trouble, the school will invite us in to see them there as well. So it isn't necessarily an immediate response if that's not what the family needs. However, if the family or referral source is looking for an immediate response, our response time goal is actually 45 minutes.
Okay, that's pretty good. And you mentioned insurances, so there's a charge for the service? How does that work?
Not really. It's interesting because emergency services is supposed to be available to everyone. And so we've actually contracted with all the different private insurance plans. We are a team run by Mass Health in some ways. And so what happens is if someone doesn't have insurance or they're underinsured, Department of Mental Health and Public Health and Mass Health end up covering that. So most people that see us do not receive a charge. It may be that if they have a private insurance, they pay a small copay or deductible. But for all intents and purposes, we're a free service.
Okay.
It just goes through the insurance company.
Okay. And are there sometimes families may be reluctant to call you because they're afraid that they may be sent to the hospital automatically? And how do you handle that?
I really try to get the word out that our goal is to really hospitalize less people and see people in the community so that they don't have to be in an emergency room setting. There's a lot of folks, not just kids, but adults and elders as well, that don't have medical issues happening at the same time as their mental health or substance abuse problem. And so these are folks that don't have to be in an emergency room in order to receive an emergency psychiatric assessment. And so we really try to help people understand that it's a small percentage of the people that we see that we're actually hospitalizing. We have access to so many different resources, both traditional kinds of levels of care as well as non-traditional things like having their pastor be part of the picture or respite at their aunt's house or something along those lines, that we are actually able to keep a lot of people out of the emergency rooms and out of the hospital.
So people can call you and maybe you'll suggest other resources for them?
Absolutely. Riverside is a huge network. We don't just refer within our system. We have relationships with all the different providers in the area. On the youth side, we have in-home therapy teams from a few different agencies. We have our community service agency here at Riverside that does wraparound care and case management. We have in-home behavioral teams that really specialize in kind of a more behavior plan, a specific regimented plan to help a kid try to stabilize. On the adult side, we have day treatment programs, we have partial hospital programs. So there's a lot of different resources that we are aware of. As an emergency service program, we're expected to be experts in all the different levels of care that are out there. And that's what we really pride ourselves on, is that we have all the numbers, all the locations that you need, and can really be creative in what we refer someone to.
You mentioned that you have staff dedicated to Newton and Needham, for example, and
Yes.
they might know the resources a little better, actually.
So we're always willing to travel to Newton and Needham. But one thing that we did last spring, because we do have such a need in the Needham and Newton area, it's such they're large towns. What we did is we added clinicians Monday through Friday, 8 a.m. to 6 p.m. in our other Riverside offices. So we have locations throughout Needham and Newton because of our presence here. And so we've had the emergency services clinicians working out of the area so that our response time is improved and so that they develop a relationship here. The two primary clinicians are Topher Nuttall and Lindsay Hively, and their name has really become kind of known in the area because they are our go-to people when we have someone in the Needham area that needs help. And so we'll send them first, and then the Norwood team is always there to back them up if there's a higher volume and a higher need.
Okay. So let's maybe just be clear about like when families should go to the emergency room and when they should call you.
I would say the go-to response is try to call us. We can always help someone triage it on the phone. The times that we can't see someone in the community are if they're having a medical emergency at the same time. We'll often ask, if it's schools calling, we'll ask the school nurse for their advice on that. We also have access to 24-hour psychiatry to figure out, is it a better time for someone to be in the emergency room because they aren't on their insulin, or, maybe they do need sutures for a cut that they have, or, maybe they are an elder with a UTI and that's why they're having a mental status change. Another would be if someone is grossly intoxicated in the moment. And then the final would just be if it's a much more violent and assaultive type of moment, that's sometimes when the police help us out. So really beyond the medical and highly aggressive folks, everyone else could come to us.
Okay. And Lieutenant Baker, I know there's a lot of times when families call you, and they should, but there's probably a lot of occasions when it would be much better if they, instead of calling the police, that if they reached out to the Riverside Emergency Services team.
Yes, well, anytime we get called, we're responding as if it's an emergency. So oftentimes that's the approach that we take. We're looking to find out. We are not experts, as the people at Riverside are, in dealing with mental health patients, but we are trained to recognize warning signs of people who may be harmful to themselves or others. We may respond and assess that the person is, potentially physically violent. That's certainly a situation where a family would want to call us. Generally, if there is an assault and there's a mental health component to it, the last thing we would be looking to do is arrest that person if they need urgent psychiatric care or mental health status evaluation. We have several options when we respond. The options that are available through Riverside are better. Our options are we can transport the person to a hospital under a Section 12, which is a order for psychiatric or evaluation or mental health evaluation. We can take somebody there voluntarily, which sometimes we do, the parents will go to, or we can call Riverside depending on the timing of it all and how quickly they could respond. Generally, call us as kind of a last resort with physical assaultive behavior or there's just nothing you can do to your loved one's off their medication and they're potentially assaultive. But I would encourage family members or whomever to look for early warning signs. Try and reach out to Riverside earlier. There's some service that Riverside's going to be able to provide. They are experts in mental health. Like I said, we're not.
I think you both made the valuable point that a lot of times you can see crises developing early, and if you sort of call earlier, it's going to be to everyone's benefit.
One thing that the community has really done a great job in sort of utilizing us more is we used to be seen as the team you'd call when someone was finally meeting hospital level of care. That's really no longer the case. The schools will call and say, Joey seems to be a little bit more unstable than usual. We figured we'd call you now rather than when he's really not doing well. So it is helpful because even if we don't see a need for a higher level of care, we're getting to know this youth and we're able to intervene earlier and possibly get them treatment so that they don't get worse. And it's really been a great model. We're also able to follow up with people for a little bit of time, and that has been able to make the contact between us and other providers involved in their life be much more continuous and much more open. And so that kind of communication is helping a lot of these youth as well as adults be able to avoid crises. So the earlier we get called, the better.
Are there ways that your two programs work together?
This is not the first time that Lieutenant Baker and I have gotten together. And Riverside as a whole has many different programs that are very well connected with the police in Needham. One thing that we've talked about is when Riverside can respond quickly, doing joint responses. So sometimes we'll have a family member call and say, I'm worried about my adult son and I think someone should lay eyes on them. He's not doing well, he's off his medication. And what we can sometimes do is what we call a wellness check. That's typically been something in the past that the police have always done. But recently, Riverside Emergency Services has said, hey, why don't we help with that? Because we do have the expertise in the mental health. And so now we have police departments calling us and asking us to come with them. So when it's sort of a planned experience, it ends up happening even better because we're able to have their expertise and ours, and a couple different perspectives makes for a better plan.
Safer for everybody too.
Safer for yeah.
And there's some grant money out there for having a mental health professional staffed at the police department. I believe Marlboro does it, and perhaps Framingham. Yeah. They're probably dealing with a higher volume, so it makes sense. But it does make sense because you're getting an expert in the mental health field as well as an officer or officers to keep the peace and keep everybody calm. And
You mentioned that you are able to respond. You'll go to people's homes, see them in their homes, or you'll see kids in school. But if people don't want you to come to their house, they can meet you some other place.
Yes, we have a lot of different office space that we can use. So we utilize spaces in Newton, Norwood, Needham. We also will sometimes go to a state agency office like the Department of Mental Health. We've gotten creative at times. We had one couple that said, I don't mind talking in public about this. Can you meet me at McDonald's? And we actually picked a corner in McDonald's and spoke quietly with them, and were able to help them that way. So, we've met in cafeterias of hospitals. We do whatever the client wants us to do. So when the person served calls and says, this is how I'd like it to go, we really try to meet that.
I hope people have learned more about what you do and will be less reluctant to call you in the future. Any other final thoughts that you want to mention before we close?
I always try to encourage people, when there's a question, just call. We consult on the phone all the time. You don't have to wait to call us just when you think you're actually going to need to meet face to face with us. We have people calling all day long just for supportive phone calls. We have loved ones or staff at certain places calling to say, what should I do in this situation? We're absolutely open to just helping the public understand what the next step should be.
I would just say that they're not alone. Our numbers with dealing with these types of calls is rising. I wouldn't want anybody to think that they're alone. And the other and last thought I have is, just encouraging people not to wait till there's a crisis, to get intervention earlier.
Well, thank you both for coming and talking about programs that can benefit Needham individuals and families. So thank you.
Thank you.